My name is Gary Mutz, and I'm the founder of Allied Senior Insurance. I've been working with Medicare health plans since 1991, and the question that I get from most of my clients all the time is, Medicare health plans are so confusing. So we've developed this video library to help explain all your coverage options and hopefully to clear the confusion. After viewing these videos, if you have any questions, or if you have a special situation that I maybe have not covered during the videos, please contact us by phone or email. Our contact information will always be at the end of each video, so you'll have it available. So let's get started. Our agenda is, number one, who is eligible for Medicare? Number two is coverage options. Number three is when can you enroll? Number four, next steps, and then finally questions. So who is eligible for Medicare? You must be a U.S. citizen or a legal resident for at least 5 consecutive years and one of the following. You have to be age 65 or older, or under 65 with a qualifying disability, or any person diagnosed with end-stage renal disease or ALS. So our coverage options that we're going to be talking about, there'll be separate segments on each one. The first one will be Part A and Part B, which is Original Medicare. Part C, which is the Medicare Advantage program. Part D, which is the prescription drug plans. And then lastly, we'll go into Medicare supplements. Our first section is Original Medicare, Part A and Part B. In this section, you'll learn what is covered and what is not covered by Part A and Part B. So under Original Medicare Part A, which is your hospital insurance, it covers inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, and some blood transfusions. Now, the costs on Part A are premium free if you've worked 40 quarters, so there is no cost. There is a deductible under Part A. Changes every year, so it just depends. It goes up a little bit each year. Coverage, it covers stays of more than 60 days, have some daily copays. You can utilize any hospital that accepts Medicare, and hospital care outside of the United States is not covered. So please keep that in mind. Okay, Original Medicare Part B covers your doctor and outpatient visits. So that will be physician services, outpatient hospital services, ambulance, outpatient mental health, laboratory services, durable medical equipment such as wheelchairs, oxygen, things like that, outpatient physical, occupational, and speech language therapies, and some preventive care. So now the costs on Part B, there is no out-of-pocket maximum, but this is a little different than Part A in that the Part B is an 80-20 split. Medicare pays 80%, you're responsible for 20% of Medicare approved costs. Now, Part B does have a monthly premium, which is adjusted based on your income, and it usually goes up every year a little bit, so please keep that in mind. And you may pay a higher premium if you sign up after your initial enrollment period. So a little confusing there, but what it basically says is once you're eligible for Part B, you need to sign up unless you have a credible coverage through your group, and then you don't have to sign up for it. But please keep that in mind. If you have a question about that, you can always call us. It also has an annual deductible. It's not very large, but it does also go up a little bit each year. Coverage, physicians, and you can go to any physician who accepts Medicare. And some preventive health care is provided. What's not covered? Under Part A and B, Medicare Part A and B deductibles are not covered, coinsurance and premiums. You have something called Medicare Part B excess charges. This comes into play if you have a doctor that does not take what Medicare will pay them. They may charge a little bit more, so you would be responsible for that. Again, that may be something that you want to talk over with us. Prescription drug coverage is not covered under Part A and B. Additional benefits such as hearing, vision, and dental are not covered, and also long-term care or custodial care if that is the only care you need. So that would be most nursing home care is considered custodial care, so that would not be covered. So in this section, we learned about Medicare Part A and B, what is covered and what is not covered. Our next section is the Part D prescription drug plans, and in this section you're going to learn about how they work and what's covered under them. Now, prescription drug plans help with the cost of prescription drugs, of course. They're only offered through private insurance companies, and you still must continue to pay your Part B premiums. As far as the costs, the coverage varies from plan to plan, so you do want to shop around and you want to make sure that your drugs are in the formulary of the plan you choose. Catastrophic coverage protects you from high drug costs, and keep in mind the benefits can change year to year. We see this happen quite a bit. Costs for the plans themselves will go up each year, but you can switch every year, and we'll talk about that a little bit later. Enrollment, each plan has a list of drugs it covers called a formulary, and that list of drugs can change every year, so the company can change the drugs in the formulary, so you want to make sure that year by year your drugs are still covered in the plan you have. Coverage is not automatic. And penalties may apply if you enroll late. So if you do not take a plan when you are eligible, you can be assessed a late penalty that will carry with you for the rest of your life, unfortunately. So please keep that in mind. The Part D formularies are all pretty much the same. I shouldn't say the list of drugs is going to be different by company, but they all have a 5-tier formulary. So your tier 1 is going to be your preferred generics, and it'll go down the list to generics, preferred brands, and then specialty drugs will be tier 5. Many plans have, well, they all have a tiered formulary. Generally, the lower the tier, the lower the cost. So the preferred generics are going to be the lowest cost. Specialty are going to be the highest cost. Coverage stages. There's 4 stages in the plans. There's an annual deductible, which is the first stage. Not all plans have a deductible, so when you shop around for them, you'll find that out. Some of them have deductibles, some of them don't. There's the initial coverage stage after that. Then you get into what we call the coverage gap or the donut hole. And then finally we have catastrophic coverage through the end of the plan year. So, and this covers most everything with some very small copays. So in this section you learned about Part D or the prescription drug plan. So in this section, we're going to learn about Part C, which is the Medicare Advantage plans, and how they differ from, let's say, original Medicare and a Medicare supplement. So the Medicare Advantage plan, or Part C, combines both Part A and Part B, and may also include prescription drug coverage, so it covers everything. So you won't need to get a separate Part D or prescription drug plan. Now, it's also offered by private insurance companies, and they often include additional benefits above and beyond what original Medicare covers. Eligibility for Part C: you must be enrolled in Part A and Part B. You must live in the plan service area, and you must not have end-stage renal disease. The costs on these vary. Plan premiums and benefits can change year to year, and you must continue to pay your Part B premium. Coverage, like I said earlier, many plans include prescription drug coverage. Coverage can be limited to a service area unless it is an emergency. So if many of these plans go by county, so you must receive coverage in that area through your plan. Unless it's an emergency, then you can go outside of the plan. You may be required to use a network of doctors and hospitals, very common in these situations, although some of the networks are very extensive. It may include additional benefits, like we mentioned earlier, above original Medicare. Now, there are a number of different types of Medicare Advantage plans. Probably one of the most common is the HMO, the Health Maintenance Organization. The other one is the PPO, or the Preferred Provider Organization. There are other plans, special plans. One is a special needs plan. There are Health Maintenance Organization point of service. And then there's a couple last ones: private fee-for-service and medical savings account. You need to find out what's available in your area, because all of these may not be available where you live. So in this section, you learned about Part C, or the Medicare Advantage program. The one thing I will tell you, it differs from original Medicare quite a bit in that it covers everything. The premiums on these plans are much lower than a Medicare supplement. It just depends on your situation and how you utilize your health care, if you're going to the hospital a lot or if you're going to the doctor a lot. And we do a lot of that, helping you through that when we meet with you. So a little bit different than original Medicare. In this section, we're going to learn about the Medicare supplements and how they fill in the gaps of original Medicare. So basically, Medicare supplements fill in the pieces that Medicare doesn't cover. Again, sold by private insurance companies. In Wisconsin here, we have different plans than the rest of the country, in that we have a base plan with a number of riders that you can add. And you can basically construct a plan that will cover most everything, almost all of your out-of-pocket expenses. You'll probably never see a bill. The benefits can vary by plan, so again, you want to make sure that in your situation that everything is covered. Eligibility: again, you must be enrolled in Parts A and B. You must be a resident of the state in which you apply for coverage. You have to be age 65 or under 65 if you have a qualifying disability. So generally, Medicare supplement helps with some of the out-of-pocket costs not paid by original Medicare, which we talked about. Premiums will vary based on the plan and the carrier. So it pays to shop around, and most of these plans are driven by zip code. So one company might be great in one zip code and not in another. So it does pay to shop around. Enrollment, generally the best time to enroll is during the 6-month open enrollment period following your 65th birthday or Part B effective date. Many people put off going on Medicare because they're still working and in a group plan through work. So you can put off your Part B effective date and join at a later time. There may be other situations in which your acceptance may be guaranteed. So if you have one of those special situations, please give us a call or shoot us an email. So the plan choices are basically original Medicare, Part A and B. You can go with just that and pay the out-of-pocket costs. Option 1 would be going with a Medicare supplement plan, which would cover pretty much everything out of pocket, but then you'd have to also pick up a Part D prescription drug plan to go with that because drugs are not covered. Or your option 2 would be to go with Part C, which is the Medicare Advantage program, which incorporates everything. So it would cover all your hospital doctor needs, and then also many of the plans, not all, also incorporate a prescription drug plan. So here we've learned about Medicare supplements and how they fill in the gaps in original Medicare. So our next section is you're going to learn about the enrollment process and when you can enroll. So the Medicare initial enrollment period is usually the month you turn 65, 3 months prior, and 3 months after. So you have a full 7 months to enroll. So what if you work past age 65? If you're working past age 65, you may enroll in Parts A and B. Recommended that you usually speak with your benefits administrator or human resources person. And the other thing to keep in mind is please keep records of your health insurance coverage, because they may ask for that if you're past 65 and you come into Medicare, they might want that. When you're retiring, you may be eligible for a special enrollment period. That may allow you to enroll in original Medicare for up to 8 months after the month your employment or employer health insurance ends, whichever happens first. Or you can enroll in a Medicare Advantage or prescription drug plan for up to 2 full months after the month your employment or employer health insurance ends, whichever is first. There is something new to Medicare working beyond 65, fewer than 20 employees. This may not apply to you, but at least I'll put it out there. Again, it's the month of your 65th birthday, 3 months prior, 3 months after. The Medicare supplement open enrollment period lasts for 6 months and begins on the first day of the month in which you're both 65 or older and enrolled in Medicare Part B. So a little confusing, it's a little different. It begins when you turn 65, and then it's another 5 months after is your open enrollment period. Although you can, usually with Medicare supplements, we send the applications in early. So most companies will accept it 30 or 60 days prior to your 65th birthday. So in this section, we learned about the enrollment process and when you can enroll. So lastly, we come to next steps, and here we're just going to briefly give you an idea of what you can do to get things going. The first one is to review your enrollment periods. Make sure you enroll on time, getting your Part B started, things like that. We can help you with that. Number 2 is to research your options. I always say it's a good idea to shop around. We're an independent agency, so we will shop all the major carriers plus many others for you. Ask questions. Please ask us questions. I've always said there's no silly questions when it comes to Medicare. Number 4 is to enroll. And the last one is a yearly review. We do this here at Allied Senior Insurance to coincide with the annual enrollment period, which is October 15th through December 7th. That is when you can change your Part D or your Medicare Advantage program. But we send out letters to our clients letting them know that the open enrollment period is coming up, and you may want to check your formularies, make sure your drugs are in there. Are you happy with the plan you have? Do you want to maybe switch? Because that's the period in which you have to switch for the following year. So again, we think that's a very important piece to include. And then lastly, questions. If you have questions, like I mentioned, call, email us. We're happy to help you. And hopefully this helped you. Hopefully this answered a lot of your questions.